Okay, hello everyone. I'm glad to open this webinar of IFHOH. This webinar will be on cochlear implants, and we have several speakers who will explain all the issues, all the relevant issues. A few comments before we start the webinar. First, about the captions. Everyone who wants to see the captions, you have to go to the buttons of the Zoom, and you see a CC button, closed caption button. If you press on this button, you see several options, and one of them is show subtitle. If you select this option, you will start to see the captions. You also have another options for the captions, and you can see a link in the chat. And this link can lead you to a separate windows with the captions. But the most convenient way to see the caption is the first one, to see it inside Zoom, as I explained, with the CC button and show subtitles. Second, about questions in this webinar. Everyone who wants to ask a question, please do so in the chat as a chat message. We will look at the chat and let the speakers answer your question after they speak. So please use the chat if you have any question. Okay, so welcome to this webinar. We are, please, can you show the next slide? Okay, this webinar is about cochlear implants, which are an electronic device that can restore some of the hearing of deaf and hard of hearing persons. Cochlear implants usually have two parts. One of them is an inner part, and the second one is an outer part. The inner part connects to the inner ear, which is the cochlea, and the outer part sits usually on the ear and collect the sounds from the air and transmit it to the inner part that stimulate the cochlea. Next slide, please. What is this webinar about? We would like to make some focus, and these cochlear implants were developed about 40 years ago. There is a lot of very advanced technology in these devices, and it improves all the time. Everyone who got a cochlear implant usually have a significant improve in in his or her hearing, and it usually are for people who cannot enjoy anymore from hearing aids. But despite all the benefits, the great benefits of cochlear implant, it looks like there is a lack of awareness to these benefits. Many people can enjoy a cochlear implant, but most of them do not have access to them. We want to discuss cochlear implant advocacy and what is the role of the consumer in this advocacy. The speakers will explain to us today several issues, most of them from the landmark international consumer paper, which you can see on the screen, all the details about it. If anyone wants to look at it, you are very welcome. Okay, next slide, please. Okay, our first speaker is Barbara Kelly. Barbara is the executive director of the Hearing Loss Association of America, which is HLAA. She is also the co-chair of the Consumer and Professional Advocacy Committee. And I want to welcome Barbara to start her speaking, please.
Thank you, Avi. I really appreciate that introduction. And we just saw Avi describe the technology and the ins and outs of a cochlear implant and what it can do to improve the quality of life for people. And I think as we talk about this topic today, that's who we have to keep in mind is the person with hearing loss. There's lots of technology to cover, and we're going to talk about this consensus paper on minimum standards of care. But at the end of the day, it's about the person with hearing loss and how cochlear implants could improve quality of life for those who no longer can benefit from hearing aids. So the Consumer and Professional Advisory Committee, or CAPAC, was formed to be involved in the Delphi consensus process, which is the study that brought physicians, scientists, and audiologists together to come up with minimum standards of care for cochlear implants. So the Consumer and Professional Advisory Committee were part of this process to ensure that the person with hearing loss was involved. And these are the people here on the slide who was on the CAPAC. Dr. Harold Seidler, who is my co-chair from Germany, is on the CAPAC along with the following members: Dr. Leo Durav, Dr. Bernard Freys, Darja Pajic, Donna Sorkin, and Dr. George Tavazonassis. And everybody on this CAPAC had an input to this consensus. Next slide, please. So what did the CAPAC do? You know, there was a list of consensus statements, and these were based on a literature search in the field of cochlear implant research. And some basic statements were provided to the physicians, the scientists, the audiologists, and to the members of the CAPAC, the consumers, to look at and make sure that the patient voice was heard in all of this. So the CAPAC looked at all the same statements that the others did. And we were there to look at the relevance of these statements. Were they acceptable to the user experience? Did they make any sense to the user experience? And we took in this KPAC, the perspectives of the people with hearing loss were considered all along the way. And I have to say, it was really enlightening because while you had the scientific perspective, this perspective was really from the real world experiences of patients who had cochlear implants. You can read a lot more about the KPAC on adulthearing.com. Who was involved, the genesis of our statements, how they all came together, and how they were brought into the final paper that was published in JAMA. So I'm going to turn it back to Avi right now, but I really appreciate the fact that the KPAC was formed and that we could bring the patient's perspective to this, because as I said, this is really what the technology is all about. It's the person with hearing loss who can benefit from cochlear implants and being able to have some hope and an option for when hearing aids are no longer helpful. So thank you for inviting me today, and I'll turn this back to Avi.
Okay, thank you very much, Barbara. Our next speaker is Harald Zeidler. He is a medical doctor, and he was in the past the DSB president. DSB is the German. Oh, just a minute, Harald. I need this slide back, please.
I'm sorry. So, it's okay.
Can you put on the my
okay.
slide, please? Okay, thank you. Dr. Harald Zeidler is the former DSB president. DSB is the German Hard of Hearing Association. He is also the IFHOH representative on the Consumer and Professional Advocacy Committee. And he is the co-chair of this committee, together with Barbara. So please, Harald, you can start your presentation.
So, hello all together, and I'm very pleased to have the opportunity for this lectures and to present you the way we have found the consensus for the use of cochlear implant. I don't know if you can imagine that it's the first time that we could get together the expert and the advocacy representative from all over the world. For me, it's very amazing because you can think that's very difficult to elect the main specialists together in the way to look if there's a consensus of fitting with of the use with cochlear implants. First, I have in my lecture to say that we are independent in this initiative. It's very important that the factories, the manufacturers, they are in the boat, but they are not. They are not have no influence in the process and in the discussion and in the finding of this consensus. So a little picture of my working place. I'm the head of ENT in rehab clinic in Germany, south west. And here's the house, and I have the ENT departments, about 130 beds. And the interesting is that's a special rehab clinic, a clinic not for acute and not with operation, but for rehabilitation from hard of hearing people. So we have about 750 cochlear implant rehabilitation the last year. Okay, so what does it mean? I will conduct you through the process of finding. First of all, some numbers of the burden of hearing loss. Uh, we know that about 466 million adults and children have a disabling hearing loss. And it's projected that this number will rise to 630 by 2030 and over 900 million by 2050. And the hearing loss has a substantial impact on people's life, especially the communication difficulties and reduced well-being. And some of you knows already that there's an interesting finding in 2017 that hearing loss that's not fitted makes the danger of the dementia and Alzheimer's disease is increasing. And so that is a very important message, that we have to fit hearing loss and with hearing aid, but the severe and the profound hearing loss with cochlear implant. And so we can, with the cochlear implant, we have in over 30 years, Barbara Kelly had already shown it, but we have a standard, a very good standard for newborns. But that's not astonishing, because the newborns is about 1 or 2% from all born children, and but the big number of hard of hearing, severe and profound, are adults. And for adults, there is up to now no standard of care worldwide. There are some national standards, and they are some different, but it's very important that we have a standard as orientation for all countries in the world. That's one of the main points for this consensus initiative. And so what we know that adults are using CI have improvements, speech perceptions, educational and employing opportunities, quality of life, and it's very important that we have many costs predicted through the CIs, because we have depression, we have retraction, and the people are isolated. And that's very important that we show this side effects of non-fitting hearing loss. And so it's be shown that cochlear implant is cost effective. It is not cheap, but when you see all costs which result of not good fitted hearing loss, then these costs are much more higher. So what means defining standard of care? That means why we are doing this. From the medical perspective, it's described a treatment which is appropriate based on scientific evidence and collaboration between professionals. So we have for all professionals all over the world an orientation what to do, what's the indication for cochlear implant, and what's the main treatments. For the legal perspective, it's a standard of care is a degree of prudence and caution required of an individual who is under a duty of care. So that means we have possibilities when there's a standard of care to make politics in many countries to introduce the fitting of cochlear implant and to show political boards that in cochlear implants this is a very important and useful matter. So what means for the patients? For the patients, it's very important that they know there is a consistent medical diagnosis and referrals and treatment guidelines are shown, and with the standard of care, they have a better access to CI treatment, and it's important, the aftercare. And the improvement in quality of life and health through optimizing hearing function and social participation and engagement. So the patient can inform all over the world about the possibilities, about the treatments, and can ask for it, and can look if there's possible to introduce this in their own country. So how we get to the consensus? First of all, we have lots of data. There are many publications, there are many releases, and they are all screened and put together to a body of evidence. So when many results of studies or publication go in the same direction, then we have a consistent opinion. So we can say that's not a single opinion, but it's an opinion of many experts in many countries. That's a very important thing to start. And so we have in the Delphi panel, we had some online rounds, and you see here the experts where they come from America, from Europe, from India and Australia. And so we had a meeting in Los Angeles in USA, and there we have the first the round of consensus. Here you see the list of the participants that are very famous and very good skilled heads of universities, of big clinics all over in many continents, which have a lot of experience in fitting this cochlear implant. So Barbara already told that this was a professional way, and now it's important, and that thing we are, which is important for this webinar, that we only can go forward, when we only make progress when we introduce the participants, the CI users, the advocacies. Because it's not enough when you make a publication in a big journal and some specialists are reading this, then you don't find the eligible candidates for CI. So it's important that we, the advocacy organizations, as you see here on the right side, for example, that we are introduced in this consensus, and so we are able then to spread this message and to inform the eligible candidates all over the world. So what means Delphi voting? That means that 75 of all participants of the specialists have to agree to some statement, to these statements. Then the Delphi voting process is successful. So I show you now the consensus statements. The first is that the awareness of cochlear implant among primary and hearing health care providers is inadequate. That means that only 5% of all eligible candidates are wearing a CI up to today. That's is a review over the world. That is not a good. That's not a good state, because 5%, 95% of the CI candidate have no access to the CI fitting up to today, and that is a very important reason we have to look forward, and we have to make this consensus initiative. And the second is detection of hearing loss in adult is important. That means we have we need screening hearing tests. For children, there are usual, that is, there are standards, but in adults, that is not a standard to make, for example, a pure tone audiometry and other methods. The addition of a questionnaire, and that's also an important thing, or interview is crucial, because not only the audiometry shows the lack of communication skills and the lack of occupational and society deficits. And so we need here additional assessments. So the third consensus statement is that speech recognition tests for cochlear implant candidacy and adults must be take place, conducted in quiet and noise. That's also an important thing. You all know to make a test in quiet is easy, and to have progress in a quiet situation is not surprising, but the most problems they are when we are in noisy environments, when there is not so the information, the audiologist information is not clear. And here it's important to make a test to show that there are lack of communication skills. Okay, good.
1 minute,
then,
please.
The fourth one is that today we can say that age alone should not be a limiting factor. That is very important and interesting. So we have today, recently, we have a lot of patients in Germany, for example, older than 80 or in the 70s, and they profit from this from this fitting of cochlear implant, and that is a very good thing that the consensus of the specialists all over the world see that age alone is not a limiting factor. So then there are consensus statement of the operation as a curved and straight electrode. I think that is more for the surgery care. And what's important that we have a soft surgery and smart surgery. We have preservation of hearing rest. No? That's many patients, when they hear one or two sounds, most in the lower frequency, they want to preserve them, and today with a new surgery fitting, it's possible in many times. Okay, so the seventh statement is that we improve speech recognition in quiet and moderate noise, and it's important that this improvement remain stable over time. So we have, meanwhile, cochlear implant user, they are fitted for more than 25 or 30 years. And they profit up to now from the cochlear implant. That is important, you know, you can know, and so we have a fitting for a long time. Okay, the 9, is quality of life in adults will be improved, and it's important that adults who are eligible for cochlear implant should receive the implant as soon as possible, not to wait until the isolation, until the lack of communication is make a lot of side effects, but to fit very early. Then the next is individual should use hearing aid with their cochlear implant in order to achieve bilateral benefits. For example, me, I have a cochlear implant on the left side for 14 years, and I have a hearing aid on the right side the hearing fitting for more than 55 years now. So it's very good possible to have both possibility, and our brain is very astonishing that they can synchrone, that they can put both signals together to a very good result. And many factors, further research must surely be done. And long duration of unaided hearing loss do not rule out potential benefits. So that is also a very interesting thing. We have patients, they have lost their hearing for more than 20, 30 years. And they can profit, they can also profit after such a long time of a cochlear implant. It's amazing. You need special training programs, sure, but we see, especially in our clinic, that there are very good results even after long time unaided hearing loss. So they have the adults should receive programming session as needed to optimize outcomes, and they need hearing loss to prevent the increase in social isolation, loneliness, and depression. And there's an association between hearing loss and cognitive memory impairment. You remember the slide in the beginning of the affecting of the Alzheimer disease. Not every hard of hearing person gets an Alzheimer. That's not right. But we can say that the cognitive and memory impairment is sure be proved. So we have the 17th that further research is required, and the use of cochlear implant, that's number 18, may improve cognition in older adults, and the treatment of hearing loss may reduce the risk of dementia. Remember, that is a consensus statement. All the experts are unique in this opinion. Number 20, finally, the unilateral cochlear implantation in adults is cost-effective when compared with no implant or no intervention at all, and is associated with increased employment and income. And that's a very important point when we want to introduce the cochlear implant in more countries, because to show that the cost of not implementation, of not intervention, is much more higher than the cost of the cochlear implant. So we have now the consensus, and it's publicated, it's released in the JAMA. That is one of the most important journals for hard of hearing, for ENT, the otolaryngology head and neck surgery, just in 27th of August of this year. And that was the publication of these statements you just have seen. And here's the internet address, which is Barbara already told. You can see the actual guidelines. So what are the further questions now? First of all, the participation of advocacy was there up to now, but it was not adequate. Why? Because we have been, we took part in this discussion, but we couldn't vote there. We have more in consultant situation, but was not voting in this in this group. And so it's now a time to say where's CAPEC going, where is the advocacy group going, and up to now we think that there are additional statements from the user's view is very crucial, and maybe the IFHOH is possible and steering committee in this forthgoing way. So what have the conclusion? The worldwide consensus initiative was a big success, and the publication is important. The existing structure is useful, but the CAPEC had the first step to participate in advocacy, but now we have further activities to do. For example, we have to say that no cochlear implantation can be successful without rehab concepts. The operation is important, but the rehab concepts are more and more important. And what we see over the time now, it's a lifelong aftercare. That is very important to stay the quality of hearing with cochlear implant. You have a computer in at your ear, and you have to look after it all over the time. Thank you very much for your attention.
Okay, thank you very much, Harald, for a very interesting presentation. We are now going to get some questions. If I look in at the chat window, I see only one question. Claire Landsman asking, is the cochlear implant for every type of hearing loss? Maybe Harald, you can answer this question, please.
Yes. Okay, it's a very important question. Sure, the cochlear implant is not for every kind of hearing loss, but only for hearing loss in which the fitting of hearing aids does not come to a good result. So when you have, for example, that's mostly the profound or severe hard of hearing loss, and when hearing aids does not fit your daily hearing skills, you get problems with in the occupation area or in your society area with the hearing aids, then you have to think about a cochlear implant. That's the thing. So the mild forms of hearing loss, sure, there will be fitted with hearing aids in the future. That is clear.
Okay, thank you. There is another message from Arlene about her book. I think everyone who wants to read it can read it in the chat. Nita Keshari from Nepal is describing the situation in her country and asking for more information. I don't see a question here. So maybe, Nita, if you have a specific question, you can ask it and we will answer it at the end of the webinar. We will have more time for question at the end. So please ask a specific question. Anyone else, if you have questions, please type your question in the chat as a chat message. I see now a new message. Gary Krantz is writing, I'm a person who has experienced several hearing loss only in the last 3 years. I've known about cochlear implant as I worked with Rush Limburg, not my politics. 15 years ago, I am now wearing sophisticated hearing aids, but my comprehension is 28% in right ear and 53% in left. My question is, how good will hearing will be afterwards? Well, Harald, maybe you are the one who can say something about this question.
Yes. The question is always, what are you hearing? What's the difference between the hearing with hearing aids and the hearing with cochlear implant? And the thing is, we are not hearing with our ears. We are hearing with our brain, and that's a very important difference and very important point of view. So when you have some with a cochlear implant, you have different signals than with a hearing aid, sure, but our brain can learn the signals to recognize them as speech, as music, as natural noises, and so on. And so it's important that we have not only the fitting to look for, but we have to look for the aftercare. We have to look for the rehabilitation. That's the main difference between hearing aid and cochlear implant.
Okay, thank you. Now another question from Nita. Is cochlear implant company provides rehabilitation services at free of cost?
Yeah.
Anyone can answer this?
Yes.
Okay, Harald, please.
Yes, that the problem is that the rehabilitation is, in my knowledge, is only in Germany very good installed. In many other countries, we have very often in clinicals we have concepts. But in Germany, in my clinic, for example, you stay 3 or 4 weeks for rehabilitation. This is something special. And but it's important because in this way we achieve a very quick result, and we can the people with cochlear implant they can return to their work, to their home, to their family very quick with a new stage of hearing. That's important.
Okay, thank you.
In many other countries it is not possible like this, and it's one of the statements aimed against that we can make new statements to say that rehabilitation is one of the most important things with cochlear implant.
Okay, thank you. We will take 2 more questions, and the rest of them will be answered at the end of the webinar. Daria, you can be prepared in about 2 minutes to start your presentation. The next question is from Debbie. She's asking, can you speak more about the effectiveness of bilateral cochlear implants from the cost and performance perspective? I think, Harald, it's you again.
Yes, it's a very important point, because you must know the statements. We have a lot of very good statements, and in one statement I'm not so totally happy, because that's a statement that only an unilateral cochlear implant fitting is for profound or severe hard of hearing. I know that many countries cannot afford it, to say that there is a bilateral fitting. But so we have to make a consensus, and we said, okay, let's say that one cochlear implant is enough. But in my opinion, in my experience here, when you have both sides, hard of hearing or deafness, you need a bilateral cochlear implant. That's a very important point. But we have to go on the way that we first have the consensus that minimum one cochlear implant in this for this group will be available.
Okay, thank you. You want to add something, Barbara?
Yes, I did. Thank you, Harold. You made that very important point based on the question. And the Delphi consensus process was based on literature search of data that has been published. And there just isn't enough literature and data published on bilateral cochlear implants. So we need to have more studies on that. And again, as Harold stressed, these are the minimum standards of care. So we hope that future studies will cover bilateral cochlear implants as well as aftercare. Every other surgery you can think about, like if you have a hip replacement, there's standards of aftercare that you follow. And we also know that the rehabilitative process and the aftercare of cochlear implants is very important as well. But these were just minimum standards based on the literature that's published.
Okay, thank you. Well, last question for this break will be from Randy, and he's asking, is cochlear implant now more affordable compared years ago? In country, it is still very expensive. Well, who would like to answer? Barbara, please.
I think Harold and I can both share this question. In the United States, Medicare, which is the health program for adults 65 and older, covers cochlear implants. Many insurance companies also cover cochlear implants as well. So maybe affordability isn't that big of an issue in the United States, but there still needs to be more advocacy for insurance companies to cover implants for children and adults. Harold, I'll turn it over to you.
No, I can support you in this state. I think that the operation, meanwhile, is on a very high level. You have only 1.5 hour duration for this operation, and you stay in hospital in Germany 2-3 days, and then you go home. So there is not a lot of difficulties and not a lot of problems you have to attend. And that's a very important thing to say. That's not a brain operation, but an inner ear operation. Many people fears about, oh, I'm operating the brain. No, you stay in the cochlea. The cochlea is out of the brain. And so you have not much post-operational, post-surgical problems. And so we can say that many of the people can profit from this. And the problem is now who makes the steering, who say, I give you a hearing aid and power hearing aid, or you go to the cochlear implantation. That's the most important point. And so we have to discuss who takes the initiative to say, okay, one is in hearing aid indicated. So it's this situation here in Germany. Okay.
Okay, thank you very much. We will answer more questions at the end of the webinar. And now we will go to the next speaker. Okay, thank you. Our next speaker is Daria Pike, and she will talk about relevant standard and cochlear implant issues based on self-experience. Daria is representing the European Federation of Hard of Hearing People. Oh, just a minute. There is a message here. And she's also on the Consumer and Professional Advocacy Committee. Daria, please, you have the floor.
Hello to all. I would like to, today I will share with you my personal experience of obtaining cochlear implants in Slovenia, and I will use consequence statements categories as a framework. So next slide, please. We think that cochlear implants are well known, but unfortunately that is a misconception. In fact, 6 years ago, when I got my first implant, my personal doctor at primary level of healthcare and my otologist were not familiar with them. Tragically, my otologist did not support me at the beginning of my interest to get a cochlear implant. My hearing aid specialist explained me more about it and about the next steps. And now, even now, 6 years later, it is not so hard to find the doctors who do not know anything about cochlear implants. Next slide, please. Clinical pathway for diagnosis and using cochlear implant would make sense. It would be great to have a universal standard procedure for determining implant acquisition and ensure that these procedures have speech recognition tests. I believe that many of adults have similar experience as I do, that doctors said to them they still hear well, although their audiogram was awfully bad. I was down because of that at that time. It is one thing to hear on a short distance in a quiet space, and quite another to be involved in a normal life. After implantation, my life has significantly improved. There are many older people who are very skeptical about cochlear implants, and it is necessary to educate them and explain to them that implant is actually comparable to an artificial knee, which allows walking just as the implant allows listening and understanding speech and music. Next slide, please. Guidelines for surgery. This statement is aimed at surgeons, but it is important to keep in mind that patients are in contact with them a lot. I can say that during my first implantation 6 years ago, I really missed a good explanation of the procedure, the presentation of the electrodes, benefits of one or another, and the procedure about operation. Of course, I found many information before implantation online, but unfortunately, there are a lot of people who do not know to obtain information online. There is also the question whether they found information properly. There can also be a language barrier, as most of the information is in English. A big problem and a big irony is that many deaf adults before implantation are not able to understand information about the procedure because of their hearing loss, and they are not given any written support such as speech to text. That's happened to me in Slovenia. Next slide, please. Ongoing testing and learning to recognize ambient sounds are must for any cochlear implant recipients. It is good to have an organized support network that encourages and supports individuals in using the implant, because it can happen that someone despairs if the implant does not work as expected. Only good rehabilitation and support and constant and lifelong care offer good results. It is not so simple as maybe somebody thinks. To have a cochlear implant means to be active in fact all the time, and to keep in touch with available technology. To have tests during rehabilitation and at the end is necessary for many of cochlear implant users, because we need to be able to see our progress in numbers, where we are to compare our understanding with people without hearing loss. Next slide, please. Since I have 2 implants, my understanding is much better. Unfortunately, hearing on my not implanted ear was before the implantation so bad that I did not have any benefit from hearing aids. Hence, I did not use it. Because of that reason, many people stopped wearing hearing aids on the other side. So it's necessary to think about implantation on both sides and to see benefits of that. I'm lucky to live in a country where that is possible. Next slide, please. The area of connectivity of hearing loss with other diseases is, in my opinion, relatively poorly recognized and considered. Depression, feelings of helplessness, withdrawal are constantly popping up. They're famous. Let's consider the current situation and whether the impact of hearing loss on a person during COVID-19 pandemic is really understood. If it was, the news and press conferences would be subtitles and speakers would use masks, which would enable lip reading. And of course, COVID measures that are otherwise required lead to additional isolation. Next slide, please. Of course, there is a strong connection between hearing loss and the working place. Hearing loss without good hearing devices, such as implants or hearing aids, means that more help needs to be provided to people with hearing loss. When I lost my hearing completely, I started to work in a lower position in my job. Of course, such a situation is not fine. Complex hearing loss, of course, leads to more health problems, not just depression. And it often affects the whole family and not just the individuals. My hearing loss has had a tremendous impact on my family and on my work. The cost of implantation is, of course, high, as is the cost of rehabilitation, follow-up care, but this is certainly significantly lower than the elimination of the consequences of non-care. Next slide, please. So, now, in my opinion, we have a good system in Slovenia. From the first idea, cochlear implant, it usually takes 1 year for an adult to get an implant to the rehabilitator. We have a well-organized sick leave, well-arranged fittings of cochlear implants. After first implantation, I stayed at home for 6 months. And I really worked on my rehabilitation, but I work in my job with people which do not pronounce their speech very well. So they let me to stay at home for 6 months, but usually you can stay 1, 2, or 3 months. And said, we have well-arranged fittings. My opinion on rehabilitation, but also many people do not understand what rehabilitation really means. You need to work by yourself a lot. Incredibly positive is peer support in social group in Facebook in Slovene language in the Slovenia area. I should mention that implants and rehabilitation in Slovenia is covered by health insurance, and that is simply marvelous that we can ask for fittings when we feel that we need it, and also that our cochlear implant surgeons now are very understanding and responding to dilemmas of clients. On that slide, you can see my audiogram for implantation in 2012, I think, and then in 2014 after first implantation, and 2020 after the second implantation. I'm still working on better understanding now because I am still in the procedure of many fittings. So I say again that cochlear implant, please. I would like to thank you for attention, and that I'm able to participate in today's event, and I would never imagine it 10 years ago. Thank you.
Okay, thank you very much, Daria. And Bowen, are you ready?
Yes. Mm-hmm.
So Bowen Tang, which he is the president of the International Federation of Hard of Hearing Young People. He will present to us, like Daria, relevant standard and cochlear implant issues based on self-experience. Bowen, please, the floor is yours.
Thank you, Avi, for having me here in this webinar. It's my pleasure to share my experiences having a cochlear implant. I'm actually entering my 20th year with the cochlear implant, and it has been a life-changing experience for me because I originally started with a moderate hearing loss when I was younger. And all of a sudden, my hearing dropped to profound, where I could not get anything out of my hearing aids at that time. And that began my journey to receive a cochlear implant on the left side. And I just have to say, it is a lifesaver for me to be able to continue to experience the sounds in my life and be able to be who I am today. The one thing that I wish I had known earlier when I first received my cochlear implant was that back in the early 2000s, the recommendations from the professionals have said that one cochlear implant was enough for me at that time. And so there was never a conversation about what to do with my other ear, was I was still able to use the hearing aid as well. But because they wanted to encourage me to make use of the cochlear implant, to learn how to use the cochlear implant and listen, as it's a very different way of listening compared to a hearing aid. So what my experience was is that I was told that I could let go of my hearing aid on my right side and just focus on using my cochlear implant completely in my early age. So that was between 10 years old to 20 years old. And in that 10 years, I did fine with the cochlear implant on its own because I was at school where I was in the environment where I had other support to allow me to access the content. But as soon as I entered the real world, going into university and eventually starting my career as a teacher, I realized that the cochlear implant itself was not sufficient enough for me to be able to hear optimally to my surroundings. So then I went to the audiologist and said I would like to have a hearing aid on my other ear. And this was when the research or that we should have both and we should have amplification on both sides. So that's when I became bimodal. And difference is very significant where I felt I could actually hear a lot better with the hearing aid compared to just the cochlear implant, because when I had the cochlear implant on the left side, I could really had a hard time hearing the person speaking on the right, and I could not localize the sound. That's where it's coming from. So that's why I really wanted to emphasize the importance of looking into having that bimodal experience if you are eligible to have a hearing aid on the other side where it is not implanted, so that you get the full experience of all the different sounds that you can get, because the hearing aids provide different features compared to a cochlear implant. So that's what my experience has been like. And I would have to say, the other important thing to consider when it comes to the follow-up care after implantation is to really take the time to get into the community of people who share similar experiences of having a cochlear implant. Having a hearing loss is a very unique experience, and each person has a different way of going through that experience, whether it could be a positive and smooth experience or a very negative and traumatic experience. But in the end, because of you having a hearing loss and getting a cochlear implant, you actually introduced to a new world, a new community where there are people who knows and who can relate to what you were going through. So from my experience, I found it extremely valuable to be able to connect with my peers who have cochlear implants or hearing aids, to be able to talk to them about the experiences and the frustrations that I have when the technologies are not working. And I can also ask them about their experiences listening to the different sounds around them, because again, each person's experience is very different. So it always broadens the perspective to be able to know how the people are experiencing music and other different spectrum of the auditory experience. So I really emphasize that when you and the follow-up care after the implantation is to really push for the opportunity to connect with other people who have cochlear implants. So at your clinic or at the hospital, you can ask the medical professionals what are the options for you to connect with people in the area, so that you can have conversations about your fears, your concerns, so that you can be given hope when you hear the stories from other people who went through the same experiences that you are going through. Because there is a great community out there, and it is also a very supportive community, and it is also the most accessible community that you can ever be in, where you can be in a safe space to really explore and navigate your journey living with a cochlear implant, where there is no need for you to be conscious about who you are, and so that you can be free to be yourself and be among friends who will support you in your journey. And that is what I want to bring to you today, so that in the hopes that you may be able to find someone that you can form a lifelong connection with as you live your life with a cochlear implant. And that is what I wanted to share. Thank you. Mm-hmm.
Okay, thank you very much, Bowen, for a nice presentation. And before we continue, we are well above 1 hour of webinar, so we will take a short break, about 5 minutes for everyone to stand up and walk a little, and we will come back in 5 minutes, and then we will have the speech of Dr. Ruth Warwick, and after that we will get some more questions until the end of the webinar. So 5 minutes break. We are coming back when the clock is on 17 minutes. Okay, see you in a few minutes.
With all the research that has come out, it is very clear that cochlear implants benefit many people, and that is less questioned today than it used to be. We revised our paper in 2010, and the paper is on the IFHO website of www.ifho.org. Next slide, please. I'm just going to briefly cover some of the components in the paper. It covers both children and adults and recommends that all of the prospective implantees and the parents of possible recipients, that being children, are fully informed when deciding to obtain a CI. And that CI evaluations and implantations should occur in a center with demonstrable expertise, including the provision of an oral rehabilitation program. So the aftercare is very important to us, stated in the paper. Next slide. And that we are very clear about the need for provision of 2 cochlear implants when warranted. So that position will not change. That is fundamentally very important, as has been expressed in this webinar. And decisions for children to be implanted should be made as soon as possible after an acquired hearing loss has been diagnosed following an appropriate assessment. We know that the earlier a child is implanted, the better it is for speech development. And the ability of a child to benefit from a cochlear implant is related to the adequacy of an aftercare program. Next slide, please. In revising the paper, we will be considering new scientific information, including the findings from the International Consensus Paper on Cochlear Implants, and considering consumer experience and feedback. So your experience and feedback will be very important to us. We have set up an editorial team that will revise the paper within 8 months is our timeline. And we are setting up an advisory committee consisting of experts and consumers. And thankfully, both Barbara and Harold have agreed to serve on our advisory committee. Next slide, please. We also have another committee, which is our overall advocacy and project committee. And this committee is working to create greater awareness of the benefits of cochlear implants among potential users, and to emphasize cochlear implants as part of the continuum of technological intervention that should be given support and funding. We will be working together with other partners. There are some other movements afoot to create greater awareness, and we are part of that initiative. And we also want to make sure that we create awareness about IFHO's updating of its cochlear implant policy paper. Next slide. We do plan to conduct additional webinars. So this is the first of several. And to be on our mailing list, if you have not already been on it, don't hesitate to email us at info@ifho.org. If you forget to do so, not to worry, we will be sending a follow-up message to all who signed up for the webinar to get your feedback about this webinar and feedback about other activities that we should be engaging in the future. And I will now turn it back to Avi, because I know that you have some questions for all the speakers, and I want to give you the available time to do that. Thank you.
Thank you, Ruth. We are now going to answer some more questions. I see that there is a lot of questions, and I must say that I'm sorry we will not be able to answer all of the questions, but we will try to answer some of them. Let me see where we stopped last time. Okay, question from Gary Krantz. Music is not recognizable at all with or without the hearing aids. Will that improve me with cochlear implants? Who want to answer this? Harald, please.
Yes, that is a main topic even in my life. When I tell you that I am playing piano, not badly, I play piano very well during the seventh year of my age. And it was a very important phase when I changed from the hearing aid to cochlear implant 14 years ago. And that was a very, very exhausting phases, because in the first 6 months, I had no benefit of music with a cochlear implant. But with training, with hearing, with exercising, I'm today able to benefit from music more than in my stage with 2 hearing aids. So it's very important to say that you can enjoy and that you can make music with cochlear implants. It's a very important message to everybody. But you have to make special training programs, to have to make it with one step after the other, and you have to have some musicians or music therapists who can accompany you.
Okay, thank you, Harald. Maybe Daria and Bowen, would you like to add something? Daria, please go ahead. You are muted. Just unmute yourself.
Yes, I unmuted myself. So I would like to say that I enjoyed to listen to the music, but I made many fittings that I found the right, comfortable music, and because I lost my hear as adult, maybe it was easier for me because I remember the music from my past. And at first I trained to listen to music with songs when I was a child. And then I remember, okay, that is similar. And then we on the fitting we prepare my processor in the right way. So, but now it's very, very different when I have 2 implants. That is a big difference than before when I had just 1.
Okay, thank you. Next question is from Thomas McGuire. He wrote, in respect of advocacy, it seems to me that an important point is whether cochlear implants are provided through the public health service free of charge, as in Ireland, or are available privately. Any views on this? Anyone from the panel can say something about the availability of cochlear implant?
I just can answer. I read on that Facebook group, international Facebook group, yes, that people are buying cochlear implants, in fact. So if you are able to pay for the operation, for cochlear implants, for the rehabilitation, I don't think that there is any problem, but it is quite expensive, and usually is easier for people to go through some health insurance. In every country, there is a health insurance system, and we know each ours, not the insurance system from the whole the world.
Thank you. Harald and Barbara.
Yes, it's a very important point. For my opinion, it's a key point of this consensus initiative, because we in Germany have a very comfortable payment through the health insurance. The indication is made by an ENT doctor. He say, okay, hearing aids are not enough, are not helpful to continue the hearing skill, and then there's the indication for the cochlear implantation. So the consensus means that everybody knows it's possible. It's not only possible to take the costs by the health insurance, but it's also useful in the economic area, because we said this in our lectures, that there's many cost saving progress when people go back to work, when people don't stay at home, when people have no side effects, other illness like depression or isolation or anxious and so on. And it's important to use the consensus to show it to other countries where the costs are not taken over up to now. That's one of the key points, I think.
Okay, thank you. Barbara, please.
In the United States, as I said before, Medicare covers hearing aids for age 65 and older, and many insurance companies also cover cochlear implants, as does Medicaid in some of our states. However, I often tell people who are having insurance reimbursement challenges to contact the cochlear implant manufacturers, because I believe all of them have reimbursement specialists who will work with the insurance companies to help the patient get reimbursement. So that's another resource where, especially in the United States, you don't have to feel that you're on your own, that you do have that support with people who have worked with insurance companies. So I encourage you to take advantage of that opportunity.
Okay, thank you. Next question is from Gary Krantz. He wrote, I have finally been recommended for Cochlear after seeing 3 ortho, this is probably doctors, over the last 3 years. I brought it up and said it was not a good idea for me. My audiologist suggested. I understand that the audiologist is not recommending and the doctors is recommending a cochlear implant. What can we say to this person? What is our suggestion to him? Barbara, please.
Well, there's a real trend for patient-centered care where, long gone are the days when your physician tells you what to do. Generally now, with good information we have, we go tell our physicians what we want. I would always get a second opinion. If you have an audiologist who's telling you that a cochlear implant isn't a good idea, I would seek a second opinion, and like you would with any health issue that you have, and get all the information you can so you're a really informed person who can make decisions based on good medical and audiological input. There certainly are some levels and degrees and thresholds that you have to meet to qualify, but I would seek a second opinion always.
Okay, thank you. Very good advice. Next question is from Sharon. how do I find knowledge provider in my area of Central Texas? Maybe Barbara, you can say something about it.
Avi, was the question, how do you find information?
She wants information, and she is in the area of Central Texas.
Central Texas. Well, you could start with your audiologist, you asking questions about where are the implant centers in the state of Texas. You could also go to the manufacturers and ask. You could go to a university speech and hearing center and ask those questions, ask an ENT. And I think in Texas, there probably are several implant centers and people knowledgeable about cochlear implants.
Yes, okay, thank you. Nita is asking about rehabilitation. Rehabilitation cost is actually more than cochlear implant, as it is lifelong rehabilitation. So is it possible to expand the rehabilitation services? What can we say about rehabilitation after we have the cochlear implant? Harald, please.
Yes, that's my special topic. I taught in my lecture that rehabilitation is nearly everything. I always say the task of the surgeon is about 2 hours operation and 3 days hospital care. And afterwards, it's the area of rehabilitation. And that's an important thing when we talk with specialists. It's not easy to understand how many surgeons that the surgery is only a small, an important part, but it's in the life view is a small part of a patient's of the patient's experience. So it's important when you start the operation, you have to bring a rehab team, a rehab system to the patient. It's not possible that you operate and leave the patient alone. That is that you can support it. So in Germany, in our consensus, we have a German consensus too. We say only those can start operation when there is a rehab team after the operation possible, when it's organized. I think it's a very important information for everybody who starts with the cochlear implant.
Anything more about rehabilitation from the panelists? No. Okay. Next chat comment is from Sue Archibald, and she is answering Gary. So we will skip this comment. Next one is Michelle from Michelle Frisbee. She is writing, will you be elaborating more next steps in order to make people more aware of cochlear implants and get them implanted in hard of hearing people? 1, audiologists need to make hard of hearing people aware of cochlear implants when hearing aids are no longer providing enough benefits. 2, audiologists also need to refer hard of hearing people to support groups like HLAA so its members can educate and advocate for cochlear implants. And 3, the cost for cochlear implants need to decrease and be more covered by insurance. How can we all help these efforts?
How about if I start with the response to that question? Those are excellent points, and these are points that we want to address in our IFHO advocacy project, as well as in a project that is bringing together professionals and consumers around the world to be able to identify what we need to do in the way of addressing and increasing awareness about the benefits of cochlear implants and the need for it, including the need to provide more information for audiologists and information for consumers. So these thoughts are particularly helpful. Thank you very much.
Okay, thank you, Ruth. Another comment is from Balmer Arch. I am hearing aid user. My hearing condition is severe to profound. There are times I need to use mobile phone at work and times I have to use headphones. How is it possible to use this equipment if I'm going implanted with cochlear implants? Who want to comment on this one? Daria,
Okay.
please.
I will comment. I'm using telephone without any, only telephone without any other system. I can speak in that way. I hear in that way, but also there is a possibility to connect your mobile phone with through Bluetooth, and then you can hear the voice in the middle of your head. So I don't think that there is a problem, but also it is necessary to understand that many people are not able to use telephone. I'm able, but my friends are not able. So there is a limit of cochlear implant. Cochlear implant is not natural hearing again. That is a technology, and something can happen and you are not able to hear again. We need to understand that. And sometimes people think, okay, I will get a cochlear implant and everything will be fine. No, it is much, much better than before. You can live normal life, but you must understand that you have electronic device on your head and that something can happen and you are not able, I'm not able to hear in the same way as Harald, but we both have the cochlear implant. So that is really need to understand. And because is that a rehabilitation team, which you talk about, Harald, is very important, and also all rehabilitation program. And we need to be very openly when
I would
about possibilities of cochlear implants.
again,
There are a big
rehabilitation. And I'd also now like to thank everyone for taking part in this webinar. We will need to close because we have gone over a few minutes and the captioners will not be available any longer.
Yes.
So I turn it over to you, Avi, to close the session. Thank you.
Okay, so I'm sorry for all the questions that we cannot answer. Hope to see you next time, and maybe we can continue somewhere. So as for now, I want to thank very much to our speakers, to all the participants who came and listened, to the captioner, to the IDA organization, and especially to Dragana, Dina, and Emmanuel, who helped us technically to have this webinar. Goodbye to all, and see you next time in our next webinar. Have a nice evening or morning or day. Goodbye.
Bye-bye.
Okay, bye.